The first heartbeat went flat at 2:14 in the morning. The monitor screamed into the air of operating room 3 a single high tone that sliced through the hiss of oxygen and the clink of metal. Overhead, the lights turned the patient's open chest into a pale hollow, slick with blood. "V-fib, he is going down," the anesthesiologist called. Her voice climbed higher than she meant. Red numbers above her head fell in sharp steps. Dr. Raj Mehta had both hands inside the man's chest. 20 minutes earlier, he had been talking the scrub nurse through the bypass almost relaxed. Now sweat gathered under his cap, his shoulders locked. "Charge the paddles, get me more blood, wide open fluids," he said. The scrub nurse nodded too fast and nearly dropped a clamp. The circulating nurse bumped a stool out of the way. In the far corner near the wall, a resident in pale blue stood almost completely still. Dr. Emma Cole watched the numbers fall. 90, 70, 40. The green line on the screen shivered, then straightened into a flat bar. "Lost him," the anesthesiologist whispered. The second alarm joined the first. A mechanical howl filled the room. Someone began compressions. Gloves pressed into the man's sternum, forcing rhythm into a silent heart. Raj stared into the red pool in the chest. Blood welled where it should not. He could not see the leak. His fingers hovered above the field. "We are not going to get him back," he said. He did not mean to say it out loud, but everyone heard. Emma did not ask permission. "Scalpel," she said. The word cut through the noise. No one moved at first. The scrub nurse turned eyes wide behind her shield. "Dr. Mehta is in charge," the nurse began. Emma's gaze met hers for a single second. "Scalpel," she repeated. There was nothing loud in her voice. It carried the weight of someone who expected to be obeyed. The handle hit her palm. She stepped into the narrow space at the table without touching Raj. The smell of cautery and blood rushed up at her. Warmth soaked through her gown. The world narrowed to the open chest, to the flood of dark red. Her hands rose into the light. She followed the blood. "More suction," she said. The tubing slurped as the nurse responded. The field cleared. Emma's gloved fingers slid along the curve of the ribs, quick and careful, feeling rather than searching. She asked for a clamp for a finer needle. Each word was quiet, precise. "Pressure is 30, the anesthesiologist called. "He is almost gone." "Not yet," Emma said. Her thumb and forefinger closed over a torn vessel. She felt the hot pulse stutter against her grip. The angle and depth were wrong for a routine case and familiar to her hands. "Clamp." Metal closed where her fingers had been. Blood slowed. Emma placed a stitch, her wrist turning in a clean arc. Another. The needle bit emerged bit again. The monitor chirped. A blip interrupted the flat tone. "Sinus rhythm," the anesthesiologist said. "Pressure 50, 60. One by one, the alarms went silent. Emma checked the line again, felt only a steady beat. She sealed a smaller leak with 2 quick throws of the needle, then straightened. "Close the chest," she said. Her gloves were red to the wrists. A line of blood had crept under the cuff to stain her skin. She glanced at it once, then lifted her hands clear of the field. Raj stared at her. The shake in his fingers had spread to his arms. "Dr. Mehta," the scrub nurse said. He swallowed. "Yes." He took the needle driver. The first stitch pulled awkwardly, then fell into a familiar pattern. Emma walked to the rear of the room, avoiding the slick patches on the floor. She peeled off her gloves and tossed them into the red bin, then pushed through the heavy door with her shoulder. The noise of the operating room dropped to a muffled hum behind her. In the observation room, above the OR behind a pane of glass, Dr. Leonard Hayes had not moved. He stood with his hands on the rail, eyes fixed on the space where Emma had been. The reflection of the lights floated on the glass, faint and shifting. A supply tech stood beside him with a tablet in her hands. "Do you need anything, doctor?" she asked. "Who is that resident?" Hayes said. She blinked. "Which one?" "The one who took over the field." She checked the tablet. Names glowed in small boxes. "Cole Emma, first-year surgical resident. Transfer from Houston General. She has been here 3 months." 3 months, Hayes said. He knew what a first year was supposed to look like in an operating room. He knew panic and luck when he saw them. What he had just watched was neither. On the floor below, Raj placed the last stitch and cut the suture. The drapes were parted. The nurses began to peel off gowns and gloves. Someone laughed a brief, shaky sound, then stopped. In the scrub room next to operating room 3, Raj stood at the sink, washing his hands. Hot water ran over the skin that already looked clean. He scrubbed past his wrists up to his elbows. He shut off the tap. Silence rushed in. His reflection in the metal splashback stared back, eyes dark, jaw tight. "Who are you, Dr. Cole?" he said. The room did not answer. 3 months earlier, Emma Cole stood just inside the sliding glass doors of Grace Memorial Medical Center and tried not to look like someone who might turn around and leave. The lobby was all glass and polished stone. Rain streaked the windows, blurring the lights from the street outside. A giant mural of the Seattle skyline stretched over the reception desk, the Space Needle rising over a painted bay. She shifted the weight of the duffel bag on her shoulder, the strap cut into her collarbone. In her other hand, she carried a dented metal box, olive green, about the size of a shoebox. It was heavy in a way that had nothing to do with its actual weight. "Can I help you?" the woman at the front desk asked. Emma adjusted her grip on the box. "Emma Cole, surgical residency. I am supposed to check in with the coordinator." The woman tapped at her keyboard, then pointed toward a bank of elevators. "Education office, 7th floor. You will see the sign." Emma nodded, thanked her, and started across the lobby. Her sneakers squeaked on the floor. The air smelled like coffee disinfectant and wet wool from coats shaken off in the entry. A helicopter thudded overhead, sound vibrating through the glass ceiling, and something in her chest tightened before she forced herself to keep walking. In the elevator, she watched the doors slide shut. Her reflection looked pale in the brushed metal. Dark circles under her eyes' hair, pulled back too tight, jaw clenched. "7th floor," the elevator voice said. The doors opened onto a hallway lined with bulletin boards. Flyers announced research lectures, journal clubs, yoga for residents. A framed photo showed last year's intern class grinning in white coats, arms around each other. The sign for graduate medical education hung slightly crooked. Inside the office, a woman with gray streaks in her hair and reading glasses on a chain peered at a computer screen. The nameplate on her desk read, "Mara's Green." She looked up when Emma stepped in. Her eyes flicked to the duffel bag and the metal box, then back to the screen. "You must be Cole," she said. "Emma Cole, you are late." "Flight delay," Emma answered. Mrs. Green did not smile. "Sit." Emma lowered the box to the floor and sat in the chair opposite the desk. The cushion sagged under her. Mrs. Green clicked through several windows on the screen, then opened the folder in front of her. Papers rustled. A small photo of Emma, taken in harsh office light months earlier, stared up from the first page. "Medical school in Texas," Mrs. Green read. "Average scores, no publications, no major awards." She flipped to the next page. "No letters of recommendation from program directors. 2 generic letters from staff physicians. A 1-line note from a community clinic in Houston." She looked over the edge of the folder. "You understand that we usually take residents from top 10 schools, high scores, strong research backgrounds." "Yes," Emma said. "You did a general internship at Houston General," Mrs. Green continued. "Then a gap of 1 year. Your file says you took time off for family reasons." Her eyes searched Emma's face. "We do not usually accept gaps without supporting documentation." Emma kept her gaze steady. The office was warm, the air tasting faintly of paper and coffee. "I had personal reasons," she said. "That is not documentation," Mrs. Green replied. Silence settled between them. The clock on the wall ticked. Mrs. Green sighed and leaned back. "Your application was strange. There were holes. The scan of your transcript has lines across it like it was copied too many times. Your references were vague. The only reason you are sitting here is because one of our trauma attendings in Houston wrote 1 sentence on the evaluation that mattered." She flipped a page and read, "She is the calmest person in the room when everything falls apart." Mrs. Green closed the folder. "We have matched you. The paperwork is signed. I do not have the authority to change that," she said. Her finger hovered over something on the screen anyway, as if she wanted to. Emma did not move. "You will start nights on the surgical service," Mrs. Green said. "Expect to be tired, expect to be wrong. The only advice I can give you is to know when to ask for help." "Understood," Emma said. Mrs. Green studied her for another moment. "Orientation starts in 20 minutes in Auditorium B. 7th floor down the hall. Follow the noise." She handed Emma a packet of papers and an ID badge on a blue lanyard. The badge showed the same harsh photo, now encased in plastic, her name printed in black beneath it. "Do not lose that," Mrs. Green said. "It is worth more than what we pay you." Emma looped the lanyard over her head. The plastic badge was cool against her chest. "Thank you," she said. Mrs. Green gave a short nod and turned back to the computer. Out in the hallway, the bulletin boards seemed louder. The smiling faces from last year's intern class watched as Emma passed. She shifted the duffel bag and carried the metal box closer to her side. Auditorium B was already half full. New residents filled the rows, whispering to each other, checking their phones, trading stories about test scores and interview dinners. The air buzzed with nervous energy. Emma slipped into a seat at the end of the 3rd row, leaving an empty chair between herself and the closest group. She set the box on the floor by her feet and folded her hands in her lap. A voice over the sound system crackled, then cleared. "Good morning," someone said. She looked up. Dr. Leonard Hayes stood at the front of the room. Without the glass barrier and the operating lights from the other night, he looked exactly the same as he had from the observation deck. tall, lean hair gone silver at the temples, tie perfectly straight. "In this hospital, you earn everything," he said. "No one owes you respect. You earn it with skill, with work, and with how you act when the easy path disappears." The room quieted. Even the shuffling of papers stopped. "There will be days when you have done everything right and something still goes wrong," Hayes continued. "There will be nights when you have not slept and the pager will not stop. Some of you will thrive here. Some of you will not." His eyes moved over the rows of faces. When his gaze reached Emma, it settled for a fraction longer than on the others. She felt it land like a weight on her skin. She dropped her eyes to her hands. Her fingers curled into her palms until her nails pressed crescents into her skin. "You will be given responsibilities that matter," Hayes said. "Lives will depend on choices you make. If that sentence does not make you at least a little uneasy, I would recommend another career." Few people laughed. Emma did not. "And remember," he said, "you are not special to this building. The patients are. You are all replaceable. They are not." The orientation moved on. Other administrators came to the podium. Policies were recited, benefits, outlined, codes of conduct discussed. Slides flashed across the screen in shades of blue and gray. Emma took notes when everyone else took notes. She wrote down locker combinations, phone numbers, the names of services she would be expected to call. Her mind drifted only once when the pager etiquette slide came up, and the tone of the hospital pager played through the speakers. The sound jolted through her. Her throat tightened. For a moment she was somewhere else under a different sky, hearing a different alarm. She forced herself to exhale slowly and let the auditorium come back into focus. After orientation, the new residents spilled into the hallway in loose clusters, still chattering. "We should all get coffee," a woman in a new white coat said, "before they lock us in the wards." "Which one of you got the trauma rotation in August?" a man asked. "Lucky, lucky, lucky," someone replied. Emma stood to the side, her back against the wall, the duffel at her feet, the metal box in her hand. No one spoke to her. No one asked where she had trained or which service she preferred. That felt safe. On the 4th floor, at the far end of a quiet corridor, she found the on-call room, assigned to first-year surgical residents. The number was taped to her packet, penciled in at the last minute. The room was barely wider than the narrow bed pushed against the wall. A small metal locker stood opposite a single window. The window looked over the parking lot, and beyond that, a strip of gray water. Emma set the duffel on the bed. The mattress springs creaked in protest. The air smelled faintly of old coffee and antiseptic wipes. She opened the locker. Someone had left a bent hanger on the rail and an empty coffee cup on the floor. At the bottom of the locker was a single folded blanket, hospital issue, pale and thin. She put the blanket on the bed. It was too short to cover the mattress, but it was something. From the duffel, she pulled 3 sets of hospital scrubs, a change of clothes, a worn sweatshirt with a logo from a high school she no longer visited, a toothbrush, a small bottle of unscented soap. She placed the scrubs on the shelf inside the locker, lined up the folded clothes beneath them, and set the soap and toothbrush in a neat row. Last, she picked up the metal box. Up close, the paint was chipped, revealing dull steel beneath. Numbers were stamped along, one edge partly scratched away. The latch was scuffed as if it had been opened and closed many times in another life. She held it in both hands for a moment. The metal was cold. Then she set it on the narrow shelf above the bed. There was a photograph at the bottom of the duffel. The edge of the picture had bent, leaving a white crease across the back. She knew, without turning it over, what was printed there. She left it face down. Emma sat on the edge of the bed and looked around the tiny room. The hum of the building ran through the walls. In the distance, somewhere on another floor, she heard the faint tone of a monitor and the murmur of voices. Her pager, clipped to her waistband for the first time in months, lay cold against her hip. She lay back on the bed without taking off her shoes. The springs complained again. The ceiling above her was a plain white rectangle. 12 hours from now, she would be on night float walking these halls with a badge on her chest and a title in front of her name. She folded one arm under her head and reached up with the other, her fingers finding the edge of the metal box by feel. Her hand rested there, as if holding something in place, as the sound of the hospital washed over her. The first week did what first weeks always did. It blurred. Days turned into nights, then back into days, all under the same hospital light. Emma learned the sound of each elevator, the smell of each floor. Pediatrics smelled like bubblegum and hand sanitizer. Oncology smelled like warm plastic and coffee. Surgery smelled like metal and scrub soap and the faint, sour note of nerves. On paper, she was a first-year on-night float with the surgical service. In practice, she was whatever the second and third years did not want to be. Who can take the post-op checks on 12, and someone would ask at sign-out. "I will," Emma said. Who wants to sit on the vascular step, down for 4 hours and watch drips? "I will." Who can cover the 3 a.m. wound vac in the ICU? "I will." After the third night, the others stopped being surprised that she volunteered. They started saving the worst jobs for her without meaning to the way water finds the lowest place. She walked the halls alone, the soles of her shoes whispering against the waxed floors. She learned the patients' names. She took notes in small, neat handwriting that attending physicians could read without squinting. She listened more than she spoke. The only place she ever saw the other interns relax was the residence lounge. It was a low room just off the main surgical workroom with a sagging couch, a table too small for the number of cups left on it, and a television that was always on with the sound turned down. The walls were covered in faded posters, most of them curling at the corners. One night, around 2, Emma stopped at the door long enough to refill her coffee from the pot that had been sitting on the warmer since midnight. Inside, 4 other first years were crowded around the table. "Did you see Hayes on rounds?" one of them was saying. "I swear he knows every lab before you even open your mouth." "At least he remembers your names," another answered. "I feel like half the attendings look straight through me." "Not Cole," the first one said, snorting. "She has some kind of invisibility cloak." They laughed. The sound was exhausted and a little mean. Emma stepped in, reached for a styrofoam cup, kept her eyes on the coffee. Conversation faltered for half a second, then picked up again. "You going home?" someone asked her. "Not yet," she said. "Of course not," another muttered under his breath. "The ghost does not sleep." She pretended not to hear, carried her coffee back into the hallway, and kept moving. The nickname made its way around the service faster than her actual name. Nurses would glance up and say, "It is the ghost tea," when she appeared at nurses' stations at 3 in the morning. An ICU tech left a sticky note on the resident computer once that read, "Ghost logged into Epic at 03:47 again." No one ever said it to her face. On a Tuesday that felt like a Thursday, sometime in her 6th week, Emma woke to the pager on her chest. The room was dark. For a second, she could not tell if it was morning or night. The numbers on the digital clock beside the bed read 21:13. The glow painted the underside of the shelf above her in dull red. Her pager buzzed again. She thumbed the button and squinted at the screen. Skills Lab, 2200, Cole. She sat up, rubbed a hand over her face, and swung her legs over the side of the bed. The metal box on the shelf above her head caught a line of light from the door, the green paint dull in the half-dark. She ignored it. The skills lab on the 2nd floor was supposed to be for scheduled teaching sessions. That late at night, it sat empty, except for a row of plastic torsos, foam pads, and the faint scent of latex and bleach. Emma washed her hands, pulled on a pair of gloves, and chose a vascular anastomosis model. It was nothing more than 2 lengths of synthetic vessel set into a foam block. The texture was wrong, the color artificial, but the resistance under the needle was close enough. She picked up a needle driver and a fine curved needle. The metal fit her hand as if it had been molded there. Her first stitch was slow on purpose, a warm-up. She placed it carefully, pulled the knot snug, checked the tension. The next stitch came faster, then faster. Soon the room shrank to the circle of light over the table. Her hands moved without hesitation, needle entering and exiting with the right bite-depth edges of the vessel aligning perfectly. Her breath stayed even. The rhythm of the suturing did what it always did. It quieted everything else. She barely noticed the door open. "That is a 16-stitch end-to-end if I am counting correctly," a voice said. Emma's hands kept moving for 1 more second. Then she tied off the suture and set the needle driver down. Dr. Leonard Hayes stood just inside the door, hands in the pockets of his white coat. He was not wearing scrubs. The tie from that morning was still straight. His hair looked a little more tired. "I did not know the lab was booked tonight," he said. "It is not," Emma answered. He glanced at the wall clock. "Some of your colleagues spend their free time trying to stay as far away from this building as possible." Emma peeled off her gloves. "I sleep here." "I have noticed," he said. He walked closer, picked up the foam model, and tilted it toward the light. The row of stitches was neat, each loop identical to the next. No gaps, no strangulated edges. It looked like the work of someone who had done it 100 times on something that was not plastic. "Where did you train for this?" he asked. "Medical school," she said. "And my internship." He did not look up. "They teach this level of vascular work in general internship now. We had good teachers," she said. He set the block down and studied her face. "First years usually come in here in packs," he said. "They leave after 10 minutes when their hands cramp." "I like the practice," she said. "That much is obvious." The air hummed faintly with the sound of the ventilation system. Outside the lab, a cart rattled past and faded. "You took over in that valve case last week," Hayes said. "You knew exactly where to put your fingers when no one else did." She did not answer. "That is not something you learn from a textbook," he said. "Or from an average year at Houston General." Emma picked up the needle driver again. Her fingers found the familiar weight. "Is there something you want me to do differently, Dr. Hayes?" she asked. He watched her for a long moment. "Not yet," he said. "Good night, Dr. Cole." When he left, the door clicked softly shut. Emma stood still until his footsteps faded, then let out a breath she had not realized she was holding. Her hands had not shaken while he was there. They did not shake now. Later that week, she was in the emergency department when the trauma pager went off. Trauma code Bay 2, ETA 3 minutes? Motor vehicle collision. The announcement crackled over the intercom. Nurses shifted into motion like someone had flipped a switch. A cart rolled out of the alcove. The trauma team gathered by the double doors. Emma stood at the edge of the group behind a third-year clipboard pressed against her chest. What do we have? Raj Mehta asked, pulling on a pair of gloves. The charge nurse read from the paramedic report. Male 32, high-speed collision on I-5, possible rollover, hypotensive in the field, no breath sounds on the left, abdominal distension. Okay, Raj said. Chest tube, 2 large bore IVs, blood-ready ultrasound as soon as he is stable enough. You are running the bay, Dr. Mehta, the nurse asked. Yes, he said. The doors burst open. The paramedics pushed the gurney in fast. The patient was pale skin, slick with sweat, a smear of dried blood across his forehead. His chest rose shallowly under the torn remains of a t-shirt. The monitor attached to his arm showed a narrow racing waveform. Pressure is 70/40 and dropping, one of the paramedics called. We have given 2 liters of saline. Move on 3, Raj said. 1, 2, 3. They shifted the patient to the trauma bed. Lines were connected, the blood pressure cuff wrapped, the pulse, oximeter clipped on. The room filled with the thump of feet, the hiss of oxygen, the rustle of plastic. Emma took a position at the foot of the bed, out of the way, but with a clear view. She watched the man's abdomen rise and fall. The left side of his chest barely moved. Breath sounds, Raj asked. Absent on the left, the intern by the head of the bed said. Chest tube left, Raj said. Cole, you can start the IVs. Yes, doctor, she said. She moved to the patient's right arm, found the vein in the antecubital fossa by feel. The skin was cool. The vessel collapsed a little under her fingertip, then filled again. She slid the needle in with a single clean motion. Dark red blood flashed back into the chamber. While she secured the line, the resident on the left side of the chest plunged a tube between the ribs. Air hissed out, followed by a small gush of blood. Pressure is 60 volt, the nurse said. Heart rate 150. Blood is here, another nurse said, hanging the first unit. Raj swore under his breath. Fast exam, he told the ultrasound tech. The tech spread gel on the man's abdomen. The ultrasound probe slid through it, images blooming in black and white on the small screen. Even from where she stood, Emma could see the dark pool where there should have been none. Free fluid in Morrison's pouch, the tech said, and in the pelvis. So he is bleeding into the abdomen, Raj said. Yes, Emma said quietly. We need him in the operating room, Raj said. Now. Elevator is tied up with another case, a nurse answered. They said 5 minutes. He does not have 5 minutes, the anesthesiologist said. Pressure 40, he is circling the drain. Emma looked at the man's belly. It was more swollen now than when he had arrived, the skin stretched tight. She could almost feel the blood filling the space behind it. He is going to arrest, she said. Not if we get him upstairs, Raj snapped. The monitor alarm grew louder. The waveform flickered, then sagged. Here it comes, the anesthesiologist said. He is bradycardic. The line flattened. Start compressions, Raj shouted. Hands went to the chest, pressing hard and fast. The bed shook. The patient's head rolled slightly with each push. Emma felt the familiar shift inside her. The noise in the room receded. The edges of her vision sharpened. The point of focus narrowed to the wound that had not yet been made. We need to open his abdomen here, she said. No, Raj said. We do not cut in the trauma bay unless there is literally no other choice. There is no other choice, she said. He hesitated. In that pause, she heard the sound of someone losing a man they could have saved. Scalpel, she said. This time no one argued. The instrument slapped into her hand. She sliced through skin and subcutaneous fat in a single long stroke from the xiphoid to below the navel. Blood welled into the incision hot against her gloves. The smell of it washed over her, metallic and thick. Retractors, she said. Hands placed metal into the wound, pulled. The abdomen opened. Blood pooled in the field. Somewhere above her head, someone called out a blood pressure, reading that barely qualified as a number. She buried her hand deep into the cavity following the curve of the spine, sweeping aside loops of bowel feeling for the source. Her fingers found torn tissue near the liver, the steady gush of an artery that did not intend to stop. Got you, she whispered. She pressed hard, pinching vessel against bone. The flow slowed under her grip. Clamp, she said. A DeBakey clamp slid into view. She guided it into place, felt it close over the vessel. The bleeding lessened from a flood to a trickle. Pack the right upper quadrant, she said. Tight. Sponges went in white, then pink, then red. The monitor stuttered. A weak upward spike appeared on the screen. Sinus rhythm, the anesthesiologist called. Pressure 60, climbing. The room let out a breath all at once. Emma did not look up. She inspected the clamp, added a holding stitch, and checked the rest of the cavity for other leaks. There were none that would kill the man in the next 5 minutes. "We can move him now," she said. "Tell the OR he is coming up open and packed." The team snapped into a different kind of motion. The portable monitors were secured. The blood bags were adjusted. Someone wiped a line of sweat from her own forehead with the back of her wrist. As they rolled the bed toward the elevator, Emma stepped aside. She peeled off her gloves and watched the gurney disappear through the doors. At the edge of the trauma bay by the doorway, Leonard Hayes stood with his arms crossed over his chest. He must have arrived sometime during the chaos. He said nothing. His eyes followed the gurney, then shifted to Emma. They regarded each other across the room for a heartbeat, then two. "Dr. Cole," he said. "Yes, sir," she replied. "Come to my office at 7, he said. "We have things to discuss." Then he turned and walked away. At 7 in the morning, the hospital was caught between shifts. Night staff moved toward the elevators with slumped shoulders and lunch bags. Day staff came in with wet hair and paper cups, coats still damp from the rain. The light in the corridors looked different at that hour, softer, almost kind. Emma stood outside Dr. Leonard Hayes' office and lifted her hand to knock. Her knuckles hovered over the frosted glass for a heartbeat. She could still feel the sensation of the torn vessel from the night before, the heat of the blood against her glove, the give of tissue under her fingers. The echo of the trauma bay hung behind her eyes. She knocked. "Come in," Hayes called. His office was larger than she expected. One wall was all windows looking out over the city, the sky low, and the clouds the color of steel. Another wall was covered in framed diplomas and certificates, the paper slightly yellowed behind the glass. On a shelf were old textbooks, some with cracked spines, and a single photo of a much younger Hayes in a dark uniform beside a helicopter. "Sit," he said. Emma sat in the chair opposite his desk, hands on her knees. The leather creaked under her weight. Hayes watched her for a moment without speaking. His hands were folded on the desk, fingers intertwined. There were faint shadows under his eyes that had not been there in the auditorium on orientation day. "You have had an active week, Dr. Cole," he said. "Yes, sir," she answered. "In the trauma bay last night," he said, "you opened a man's abdomen in less than 10 seconds. You found a bleeding hepatic vessel by feel. You clamped it without hesitation." "He was dying," she said. "Yes," Hayes said. "He was." He picked up a pen, rolled it between his fingers, then set it down again. "You understood exactly what you were doing," he said. "That is what concerns me." She held his gaze. "I followed what I was taught," she said. "Where?" he asked. "That is the question." He glanced at a folder on the desk. Her name was printed on the tab. "Your file from Houston General shows a standard internship," he said. "Rotations on medicine surgery, ICU. Nothing that explains your comfort with emergency laparotomy in a hallway. We had a busy trauma service," she said. "So does this hospital," Hayes replied. "No one on our first-year roster would have made that call as quickly as you did." Silence stretched in the room. The city outside the window moved in slow motion, cars threading along wet streets. Hayes leaned back in his chair. "I do not like surprises in my operating rooms," he said. "I especially do not like them in my residence." Emma unclasped her hands. Her fingers were stiff. "Would you prefer I had not opened his abdomen?" she asked. "I would prefer to understand who is holding the scalpel," he said. He let the words sit there between them. "What are you asking me, Dr. Hayes?" she said. His eyes narrowed not in anger, but in calculation. "I am asking where you really learned to operate like that," he said. "Because it was not on plastic models in a skills lab." She thought of desert sand and green canvas and metal tables that shook when the ground did. The smell of diesel and dust and burned cordite. Her hand for an instant felt the weight of a different scalpel. "Medical school," she said. "My internship. I had good teachers." He watched the small changes in her face, looking for a crack. "You have a year missing in your record," he said. "Family reasons." "Yes," she said. "Is your family in Texas?" he asked. "No," she said. "Where are they?" he asked. "Alive," she said. It was not an answer. He let it pass. He opened the folder, skimmed a page, closed it again. "Whatever you did before you came here, whoever trained you, it has left you with skills that most of my third years do not yet have," he said. "It has also left you with habits." He paused. "You did not ask for permission in the trauma bay," he said. "He was arresting," she said. "If I had stopped to ask, he would have died." "Perhaps," Hayes said. "You were right. You were also lucky I agree with you." He let out a slow breath, then rubbed a thumb along the edge of the folder. "I am not going to report you for opening him downstairs," he said. "I am not going to write you up. I am going to tell you that from now on, if you are going to break protocol, you better be prepared to explain it to me in great detail." "Understood," she said. He nodded once. "We have a high-profile case coming in tonight," he said. "The governor is being transferred from a community hospital in Tacoma. Abdominal pain, low grade, Fever concerning labs. There is a possibility he will need surgery. Emma went still. Governor Reed, she said. Yes, Hayes said. You can imagine the pressure that comes with opening a politician who has his face on billboards. I can imagine, she said. Hayes studied her expression, as if looking for some sign of recognition. I want you on that case, he said. She blinked. You want a first year on a governor's surgery? I want the person who kept a man from bleeding out on my trauma bay floor in under a minute, he said. You will not be lead. You will assist. You will also keep your head when other people lose theirs. Can you do that? Emma looked at him. There was no amusement in his eyes, no test, only expectation. Yes, she said. I can do that. Good, he said. Scrub in at 2100. You are dismissed, Dr. Cole. Try to sleep before then. She stood. At the door, he spoke again. Whatever you are hiding, he said, I will find out. I do not say that as a threat. I say it as fact. I do not like unknown variables in my hospital. She did not turn around. Understood, she said. In the hallway, the fluorescent lights hummed softly. Emma walked back toward the residence on call room. At the far end of the corridor, an exit sign glowed red above a set of doors that led to the parking garage and the street. She stopped and looked at it. 12 steps. That was all it would take to push through those doors, cross the concrete, disappear into rain and traffic and another city. Her duffel bag would fit back over her shoulder. The metal box would fit back into her hand. Her pager buzzed against her hip, a small, insistent vibration. She closed her eyes for a moment, then turned away from the exit and kept walking. The afternoon thickened. The sky darkened early clouds, pressing low over the city. By 2100, the air outside the hospital tasted like wet concrete and exhaust. Inside the corridors felt almost too bright. Emma scrubbed her hands at the sink outside operating room 1. The water was hot, almost burning the skin at her wrists. She watched the foam swirl away pink at first, from the residue of earlier cases, then clear. Beside her, Raj Mehta washed up lips pressed together. You all right? He asked without looking over. Fine, she said. Ever operated on a politician before? He asked. No, she said. He gave a short, humorless laugh. They are just like other people, I keep telling myself. Except with better lawyers. In the anteroom, the circulating nurse reviewed the checklist. Patient is Governor Thomas Reed, she said. 62 years old, transferred from Tacoma General, right lower quadrant pain fever, elevated white count, ultrasound inconclusive. Appendicitis, Raj said. It is always appendicitis until it is not. He pulled his mask up over his nose and pushed through the OR doors. The operating room had been scrubbed to a shine. Extra equipment lined the walls. A security agent in a suit stood just inside the door, hands clasped in front of him. Another guard waited in the hallway. The anesthesiologist adjusted the drip, watching the monitor. The governor lay on the table, skin pale against the blue drapes. A tube in his throat, his stomach prepped and draped in a square of exposed skin. Everyone ready? Raj asked. There were nods around the room. Emma took her place opposite him at the patient's left side. She checked the instrument table with a glance, the neat rows of steel, calming in their order. Scalpel, forceps, clamps, needle drivers, everything where it should be. Incision, the nurse said. Scalpel, Raj answered. He made a clean cut in the right lower quadrant, opened the layers one by one. There was a small release of pressure and a faint smell of warm tissue. Emma watched his hands. They were steady now, knuckles dry. Retractors, he said. They opened the wound a little wider enough to see the cecum in the base of the appendix. Except the appendix looked normal. Raj frowned. That is not what I expected, he said. Emma leaned in. The bowel around the area looked edematous, slightly discolored. There was a thin sheen of cloudy fluid in the cavity. Something else is going on, she said. Extend the incision, Raj said. They lengthened the cut. When he lifted a loop of small bowel, a stronger smell hit them sharp and foul. The serosa was mottled. In one segment, there was a faint, dark line. Perforation, Emma said. Get suction in there, Raj said. The suction tip hissed as it drew away fluid. Behind the active field, the security agent shifted his weight, the only sign he understood none of what he saw, but all of what it meant. This is not a simple appy, the anesthesiologist said. Doctor, his pressure is soft. You need to be quick. I know, Raj said. He tried to mobilize the affected segment. His fingers slipped on the slick surface. The bowel threatened to tear where it was most fragile. Emma watched his jaw tighten. Take it slow, she said. Easy for you to say, he muttered. The monitor beeped faster. Pressure is dropping, the anesthesiologist warned. 80, 70? Raj hesitated, his hand hovering over the diseased segment. The risk of ripping it open and pouring contamination into the abdomen was suddenly very real. Emma could see the calculation in his eyes. She knew that math. She had done it more times than she could count on tables that were not this clean. We need to resect that portion and create a diversion, she said. If it blows, he will be septic before we can close. I know what we need to do, Raj snapped. His hand shook once. Hayes's voice came down from the observation window above. He had appeared without anyone announcing him, his silhouette visible against the glass. Dr. Mehta, he said through the intercom calm and level, if you are not fully confident, step aside and let someone else take the lead. The room went very quiet. Raj looked up at the glass, then at Emma. For a second, pride and fear wrestled behind his eyes. Then he stepped back from the table. Dr. Cole, he said, take it. Emma did not say thank you. There was nothing to thank him for. She slid into the space he left her hands already reaching for the mesentery. The tissue felt fragile and hot under her fingers, but the movements were familiar. She placed clamps where she needed them, marked the lines of resection, asked for ties and staplers in a voice that did not waver. The resected segment came free, a swollen, angry loop of bowel that smelled of rot. The nurse dropped it into the specimen basin with a wet thunk. Stoma site marked, she asked. Left lower quadrant, Emma said. Bring it up gently. Do not twist. They worked in a tight circle of light, the rest of the room receding. The hum of the ventilator, the beep of the monitor, the shuffle of shoes on the floor, all became background. As Emma was placing the final sutures around the stoma, there was a soft sound from beyond the drapes. A small, rough exhale that did not match the rhythm of the ventilator. The anesthesiologist glanced at the governor's face. He is lightly under, she said. Blood pressure changes shifted his depth. I will adjust. Before she could, the governor's eyelids fluttered. His pupils tracked for a second, unfocused, then fixed on the ceiling. Emma did not often look at patients' faces during surgery. The field held her attention. This time something tugged at her, a thin thread of instinct. She glanced up. His eyes, cloudy with drugs, moved toward her voice, toward the movement of her hands. Not yet, she told the nurse, tying off a stitch. Hold that retractor steady. The governor's lips moved. No sound came out at first. Then he managed a harsh whisper. Kandar Ridge, he said. Emma froze. Her hand held the needle in the air, half a stitch left unfinished. The room did not change. The monitor still beeped. The ventilator still sighed. The lights still burned hot on the field. Inside her skull, something tilted. The governor's gaze tried to find her. You, he whispered. You were there. You saved my boy. The anesthesiologist leaned over him. Sir, you need to rest. Try not to talk. His fingers twitched against the sheet. Luke, he said. You saved Luke. Emma could not breathe for one long suspended second. Dr. Cole, the scrub nurse says I. Quietly. Suture. Emma forced air into her lungs. She looked back at the incision, at the pink ring of mucosa, at the neat circle of skin where the stoma now sat. Her hands moved again, finishing the pattern of stitches, sealing the edges. Check counts, she said. Her voice sounded distant to her own ears. Sponges correct. Instruments correct, the nurse replied. Emma inspected the rest of the field. No bleeding, no leaks, nothing left undone that mattered in this moment. We can close, she said. They brought the layers of the abdominal wall back together. Each stitch was placed with automatic precision, as if her body had decided to work on its own, while the rest of her lagged behind. When the last staple snapped shut, the anesthesiologist adjusted the medication. The governor's face relaxed. His eyelids drifted fully down. Vitals are stable, she said. He should do well assuming no further complications. The security agent at the door shifted again, shoulders dropping a fraction. Emma stepped away from the table. She stripped off her gloves, one inside the other, and tossed them into the red bin. Her hands underneath were damp, the skin pale from scrubbing and sweat. She did not look up at the observation window as she walked out of the operating room. The locker room door swung shut behind her and cut off the voices like someone closing a book. Emma leaned her back against the cool metal and let her eyes close. The fluorescent lights hummed overhead. Somewhere beyond the wall, a monitor chirped in a slow, steady rhythm that did not belong to her. Her stomach rolled. She pushed away from the door and walked to the row of sinks. The mirror above them reflected a stranger, in a blue cap and mask, pulled down around her neck, eyes too wide in a face powdered with floury, dried glove powder. She turned on the tap. Water rushed out hard and clear, splashing against her hands, against the steel basin, against the tile. The sound filled the room and then changed. In her head, it thickened and deepened, blending with another sound that lived in the back of her skull. Not water, not here. Rotor wash, engines, the high whine of a helicopter cutting through hot air. She gripped the edge of the sink with wet hands. The world tilted once. The locker room faded. Dust blew into her face, hot and dry. It tasted of grit and smoke. The sky was washed out above the tents, the sun a white coin behind a haze of sand. She stood under canvas instead of plaster and fluorescent light. The air smelled of sweat, antiseptic, and burned metal. A generator chugged somewhere behind the hospital tent, a low grinding hum with a beat that did not quite match the thud of her heart. "Incoming!" a voice shouted outside. The first explosion was distant, a dull thump that turned the air inside the tent into a taut string. "Lieutenant Reed, male 26 blast injury," a medic yelled, dragging a stretcher through the flap. Emma moved before she thought. Her body knew the path between the tables, the gap between two hanging IV bags, the exact angle of the rolling tray she had to slide past without sending instruments clattering. The man on the stretcher was long, all limbs and gear and blood. One sleeve of his uniform was shredded, the fabric blackened around the edges. His chest rose in uneven jerks. His face was too pale under the dirt, and sweat freckles standing out against skin like paper. She cut through the vest, dropped it to the floor. It hit the ground with a heavy clatter, ceramic plates cracked and leaking white dust. There was a deep open wound near the left side of his chest, edges ragged and burned. With each breath, blood bubbled from it, pink foam frothing between bits of shrapnel. "His name?" she asked. "Luke Reed," the medic said. "Convoy got hit. He was closest to the blast. We have already lost 2 from the truck." His voice tried to stay flat and failed. Emma pressed 2 fingers to the side of Luke's neck. The pulse was too fast, too weak. "Sats are in the 60s, a nurse called. Pressure is 80 and dropping." His left leg was soaked in blood from mid-thigh down. The fabric clung to his skin. She could see the shape of a tourniquet above the knee, the strap pulled as tight as the medic could manage in the field. "Get him intubated, muscle," she said. 2 large bore IVs. Cross-match him. I want blood ready." "Already on it," the nurse said. His eyes fluttered open as she leaned over him. They were light washed out in the harsh tent light, trying and failing to focus. "Stay with me, Luke," she said. "Ma'am," he whispered. Another explosion sounded closer, rattling the metal pans. Dust drifted down from the ceiling, little puffs of pale powder landing in her hair, in the corners of the tray. A siren wailed outside the base alarm, cycling through its pattern. A figure filled the entrance to the tent. Major Clark, her commanding officer, wore a helmet and a frown that seemed carved into his face. "Captain Cole," he said, "we are pulling back. The convoy is under sustained fire. Evac choppers are 20 minutes out. You have 10 minutes to stabilize any red tags and get them ready for transport." Emma did not look up. "This one is red," she said. "He is not stable." "Then tag him black and move on," Clark said. "We are not losing more people trying to save one who will not make it." She slid a finger into the chest wound, feeling the edge of air sucking in and out with each breath. The underlying lung crackled under her glove. Somewhere deeper, she felt the jagged edge of bone. "He has a chance," she said. "If we get his leg and his chest under control, he has a chance." "Everyone here has a chance if you throw enough time and blood at them," Clark said. "We do not have that luxury. You have 10 minutes. He stepped closer so only she could hear the next words. "This is not a civilian hospital," he said. "We do not get to pretend the rules are the same." Emma looked at Luke. He was younger than her by nearly a decade. A strip of pale skin at his wrist marked where a watch had been before someone cut it off. He struggled against the mask, the anesthetist pressed over his face. Instincts fighting even as his consciousness faded. A hand brushed her shoulder. One of the nurse's eyes wide. "Captain," she whispered. "The next wave is on its way in. We already have 4 on stretchers outside." Emma's mouth tasted like dust. "How long until evac?" she asked. 20 minutes to wheels down," Clark said. "After that, pilots will not land with this kind of incoming." Luke's blood soaked the pad under him. It dripped off the edge of the table in slow, heavy drops. "Get the other red tags into the second bay," she said. "Start compressions on any pulseless until we can get to them. I will need the portable suction and my chest tray here, and someone get me a surgical tech who is not shaking." Clark's jaw tightened. "Captain," he said. She met his eyes. "If we roll him out in 10 minutes, he dies in the helicopter," she said. "If we leave him, he dies here. If we operate now, he might live." Might. It was a thin edge to balance on, but it was still an edge. "You are choosing one over many," Clark said. "I am choosing not to walk away from a breathing man who can hear me," she said. Another explosion hit nearer the perimeter. The tent shook. A clamp slid half an inch on the metal tray with a ringing tap. Clark stared at her for a heartbeat, eyes full of a fury that had nothing to do with her and everything to do with the situation. "You have 15 minutes, he said finally. "Then I drag you out myself." He turned and stalked away, shouting orders before he was even through the flap. Emma looked at the scrub nurse. "Gloves," she said. They worked fast. When she opened Luke's chest, air hissed out around her fingers, carrying with it the smell of burned flesh and smoke. She found the tear in his lung, clamped off the worst of the bleeding, slid a tube between his ribs to let the trapped air escape. His blood pressure sagged, then steadied. His leg was another battlefield. The tourniquet had slowed the loss, but had not stopped it. A large vessel had been shredded edges, frayed like cloth. Every time the medic's hand slipped, blood pulsed out in bright spurts. She tied off what she could, packed what she could not reach, yet her mind running ahead, mapping the order of the next moves. The siren outside continued its steady wail. The harsh sound vibrated in her bones. At one point, the tent flaps blew inward with a gust of hot wind. Dust swirled over the floor, threatened to settle into the open wounds. Someone cursed. Someone else pulled a sheet up to shield the field until the gust passed. 5 minutes, a voice shouted from the entrance. Almost there, Emma said. She did not look up to see who had called. Her world was an arc of skin and muscle, a red river she was trying to dam with metal and thread. When she placed the final clip on the torn artery in Luke's leg, her hands were slick with blood. The suction had clogged twice. There were red smears up her forearms where sleeves had ridden back. Pressure is 85 and holding, the nurse said. Heart rate 120, oxygen in the 80s climbing. Cover the wounds, Emma said. He goes on the first bird. Clark appeared again, breath harsh. They are loading now, he said. We leave in 3. Emma helped lift Luke to the transport stretcher. He was lighter than he looked, or maybe adrenaline made him so. His face was slack. A faint line between his brows gave away some distant pain. As they pushed him toward the exit, he stirred. His eyes opened a crack. Ma'am, he rasped. I am here, she said. He tried to smile. It came out crooked. You are a terrible liar, he whispered. She did not understand what he meant until later. The rotor wash hit her as they rolled him out to the landing zone. It whipped at her scrub cap, dried the blood on her gloves into a tight film. As the helicopter lifted, she stood with one hand pressed against the side palm, flat on the metal, feeling the vibration pass into her bones. Only when it was a speck in the sky did she lower her arm. The base alarms continued to wail. They did not stop for hours. The courtroom was quieter. Weeks had gone by. Kandar Ridge had turned into a line in a report and a set of coordinates on a map. The hospital tent had been replaced by a room with dark wood panels and heavy chairs that scraped too loudly against the floor. Emma sat at the plain table in her dress uniform. Her name tag caught the light when she moved. Captain. It felt heavier than any rank she had ever worn. On the bench, 3 officers watched her. A 4th read from a sheet of paper. Captain Emma Cole, he said. You are charged with willful disobedience of a direct order under conditions of hostile engagement. By remaining in a forward surgical position beyond the mandated evacuation window, you placed yourself and your team at increased risk. She stared at a point on the wall above his head. The man from the Judge Advocate General's office had told her to keep her answers short. Yes, sir. No, sir, I understand, sir. He had advised her to show remorse, or at least the appearance of it. He had not been there when Luke Reed's chest stopped rising and started again. How do you respond? The officer asked. Her mouth was dry. Sir, she said, I did not obey the evacuation order. That is correct. Did you understand that failure to comply with that order exposed your staff to increased danger? He asked. Yes, sir, she said. Why did you remain? He asked. She could have said that she miscalculated, that she lost track of time, that the chaos made it impossible to hear the orders clearly. Any number of reasons might have softened what they were about to do. Instead, she said, because my patient was not dead yet. A muscle jumped in the officer's jaw. Do you have family in the service, Captain? He asked. No, sir, she said. Then perhaps you do not understand that sometimes a life must be weighed against the lives that can be saved if orders are followed, he said. She thought of the faces in the tent, the nurses who had stayed, because she stayed the medics, who had brought in more bodies, even as rounds landed closer to the wire. I understand it, sir, she said. I do not accept it. The gavel sounded louder than the explosions at Kandar Ridge. She lost her rank. She lost her position. She was told she would leave the service with a discharge that might as well have been a stain printed across her back. When she stepped out of the courtroom, the air in the hallway smelled like floor polish and paper. No dust. No smoke. No blood. She carried a cardboard box with her belongings, a folded uniform, a pair of boots, a small olive green metal box. She did not look back. The water in the locker room sink at Grace Memorial was still running. Emma blinked. The fluorescent lights came back into focus. The smell of dust and diesel retreated, replaced by the sharp, clean scent of hospital soap. Her hands were clenched around the edge of the basin. Her knuckles were white. Water ran over her fingers, over the faint marks her nails had left in her palms. She shut off the tap. The locker room was empty. No one had come in. No one had seen her with her head bowed over the sink, breathing like she had just run up a hill. She straightened and met her own gaze in the mirror. For a long moment, the woman looking back at her was Captain Emma Cole, with the lines of the desert still etched around her eyes. Then the reflection shifted. The blue cap and hospital scrubs, the badge clipped to her collar. Dr. Emma Cole. The 2 names sat side by side inside her head. Outside down the corridor, someone called a code. The alarm blared through the speakers, sharp and insistent. She reached for a towel, dried her hands until the skin felt raw, and left the locker room. The page came just after sunrise. Emma had slept in snatches, if at all. She lay on top of the call room bed, still in scrubs, the blanket twisted around her ankles. Light from the window pushed at her eyelids, a pale gray strip across the ceiling. Her pager vibrated against her hip. She fumbled for it, blinking at the screen until the letters came into focus. Chief of Surgery, Office, 0700. Her mouth tasted like old coffee. Her shoulders ached with a deep, tired pull. The memory of the governor's eyes, cloudy, uncertain, slid into place as soon as she was fully awake. You saved my boy. She sat up, swung her feet to the floor, and pressed her thumbs into her eye sockets for a second. Then she stood, straightened her wrinkled scrub top, and clipped the pager back to her waistband. The hallway outside the call room was full of the soft chaos of shift change. Nurses walked in pairs, holding travel mugs and talking in low voices. A janitor pushed a cart loaded with trash bags that rustled with each step. Someone laughed near the nurses' station, the sound thin but genuine. Emma walked past all of it toward the administrative wing. When she reached the door, with Chief of Surgery stenciled on the frosted glass, she stopped. Behind the glass, she could see a blurred shape move then sit, a shadow of someone adjusting papers, of someone waiting. She could turn around. Her bag was still in the call room. The elevator to the parking garage was 30 steps behind her. The city outside was big enough to swallow one more person who did not want to be found. Her hand curled into a fist. She knocked. Come in, Hayes said. His office was as she remembered it. City View diplomas, the photo of the younger Hayes in uniform beside a helicopter. Today there was something new. A woman in a dark suit sat in one of the chairs opposite his desk, ankles crossed, a closed tablet resting on her knees. She turned her head as Emma entered. Her hair was pulled back, her posture relaxed without being casual. There was a badge clipped to her belt. Dr. Cole, Hayes said. Sit down. Emma sat in the empty chair beside the woman. The leather felt even more unforgiving than it had the last time. Special Agent Alvarez, Hayes said, nodding at the woman. Federal Bureau of Investigation. Morning, the agent said. Captain. The last word landed with a weight that pulled the air out of Emma's lungs for a second. I am a first-year surgical resident, Emma said. That is not the only thing you are, Alvarez said. She reached down, picked up the tablet from her knees, and woke it with a swipe of her thumb. The screen glowed. She turned it toward Emma. A photograph filled the display. A woman in desert camouflage hair, tucked under a helmet, a stethoscope looped around her neck. The name above the pocket read, Cole. The rank on the collar was clear. Captain Emma Cole Medical Corps. The background was a stretch of sand and the outline of a tent. The woman's eyes in the photo were the same as in the locker room mirror. Only the lines at their edges were fewer. I imagine they did not ask for this picture for your residency application, Alvarez said. Emma looked away from the screen. That record was sealed, she said. Sealed is not erased, Alvarez said. Not if someone really wants to find it. Hayes rested his elbows on the desk. His expression was hard to read. I suspected something was off, he said. Average school average scores one missing year and hands that work like that. But this is more than I imagined. Alvarez tapped the tablet. The image changed. A list of text. Kandar Ridge Forward Operating Base, she read. 3 deployments. Primary role, surgical officer trauma, commendations for valor. Then court-martial disobedience of direct orders, separation from service with dishonorable discharge. She looked up. You were very busy, Captain, she said. My discharge was final, Emma said. I signed the papers. I left. You disappeared, Alvarez said. You changed addresses 6 times in 8 months. You took jobs that paid cash. You kept your medical license in limbo. You did everything you could to slide out of sight. You seem to have found me anyway, Emma said. Not just me, Alvarez said. The governor of this fine state has been looking for you for 3 years. Emma's chest tightened. You were in his operating room last night, Alvarez said. He recognized you while half sedated. That is a rare thing. He recognized me because of his son, Emma said. Luke Reed, Alvarez said. 2nd Lieutenant, United States Army, awarded a Purple Heart. Honorably discharged with medical retirement after surviving injuries that should have killed him. He tells anyone who will listen that a trauma surgeon in a tent in the middle of nowhere saved his life. A surgeon named Cole. The room seemed smaller by the second. Hayes watched Emma closely. He looked less like an administrator now, and more like the man in the uniform in the frame. Why did you not tell us any of this? He asked. Emma kept her eyes on a point just past his shoulder. Would you have hired me? She asked. He did not answer right away. That is not the question, he said. It is the only one that mattered when I filled out the forms, she said. Alvarez leaned forward slightly. The governor has questions, she said. So does the Department of Defense. So do I. Before we can get to any of them, I need to hear it from you. Kandar Ridge, the evacuation order. Why did you stay? The memory was still close raw from the way it had forced itself to the surface in the locker room. The tent, the dust, Luke's breath rattling, the gavel, the word dishonorable ringing in a room that smelled like floor polish. Because he was alive, she said. There were others who were alive, Alvarez said. You were told to prioritize the many. I did, Emma said. I trained my staff before we ever got hit. They knew the protocols. They knew how to handle red tags, yellow tags, black tags. They needed me in that bay more than they needed me running to the helicopter without my hands on anyone. But you were ordered to go, Hayes had said. Yes, she said. And you refused, he said. Yes, she said. Knowing what it would cost you, he said. She thought of the courtroom of the box with her uniform of the quiet that followed when the base stopped speaking her name over the intercom. I did not count the cost at the time, she said. I counted the heartbeats. For a moment, the only sound in the office was the faint ticking of the clock on the wall. Alvarez studied her as if memorizing the set of her shoulders. The governor has already been in touch with the Judge Advocate General's office, she said. He has been pushing for a review of your case since he found out how his son survived. He did not have a name until last night. Emma felt her jaw tighten. I am not interested in sympathy, she said. This is not sympathy, Alvarez said. This is a man with influence and guilt and 3 years of time to think about the way the system treated the person who kept his son breathing. Hayes's phone buzzed on the desk. He glanced at it, his mouth hardening as he read the screen. Before he could say anything, the hospital's overhead speakers crackled to life. Attention all staff, a voice said. Mass casualty incident. Repeat mass casualty incident. Chemical train derailment at Harbor Junction. Multiple casualties en route. All available trauma, surgery, and emergency staff report to the emergency department immediately. The words hit like a physical impact. Alvarez's phone lit up almost at the same time. She checked the caller ID, then stood. They will want a federal presence on this, she said. Hazmat local police fire, maybe Homeland, if anyone utters the word sabotage. Hayes was already on his feet. He looked at Emma. How many events like this have you handled? He asked. She did not need to ask what he meant. More than I can count, she said. Explosions, multiple blasts, mixed injuries, not with trains, with trucks, with roadside bombs. Can you run triage? He asked. She thought of Kandar, of dust and tents and red tags, of bodies on stretchers, of hands grabbing at her as she passed. Yes, she said. He gave a single sharp nod. Then for the purposes of the next few hours, you are not a first-year resident, he said. You are a trauma surgeon with combat mass casualty experience. You answer to me and to the head of emergency. Everyone else answers to you. Alvarez looked between them. That is going to raise questions later, she said. So will a pile of bodies in our ambulance bay, Hayes said. They were already moving toward the door. The elevator down to the emergency department was full of people in scrubs and coats, all speaking at once. Someone held the door for them. Someone else asked if anyone knew real numbers yet. Fire is reporting at least 30 injured, a nurse said. Maybe more. They are still pulling people out. The doors opened onto a different world. The emergency department was lit brighter than usual, every overhead lamp on. Nurses rolled carts into place, loading them with airway supplies, IV kits, dressings. The waiting room had been cleared. Patients moved down the hall, chairs pushed aside to make space for more stretchers. Monitors beeped even when they were not attached to anyone yet, as if impatient. Dr. Cavallo, the head of emergency medicine, stood in the center of the main room, shouting orders that barely carried over the noise. We will use trauma bays 1 through 4 for reds, she said. The hallway and overflow rooms for yellows. Greens can go to the auditorium once they have been cleared. Hayes stepped up beside her. Dr. Cavallo, he said. This is Dr. Cole. She has run multiple mass casualty events in the field. I'm putting her in charge of triage with your approval. Cavallo's eyes flashed toward Emma. She took in the slight figure in tired scrubs, the badge that still said resident, the calm in her face. Have you done chemical exposures? Cavallo asked. Lungs, skin, eyes, Emma said. Industrial solvents, fuels. Nothing on the scale of a train, but the principles are the same. Cavallo nodded once. Fine, she said. You stand at the ambulance bay doors. You tag red, yellow, green, black. You send reds to my left yellows, to my right greens, to the far wall. Anyone black goes to the chapel until the coroner gets here. Understood, Emma said. A clerk handed her a belt with rolls of colored tags. Red, yellow, green, white. Her fingers closed around them. The paper felt too light to carry what it meant. The first sirens reached the bay as she took her position at the threshold. Outside, rain had started again, a fine mist drifting across the lights. The smell of diesel and wet concrete and something sharper rode in through the open doors, an acrid bite that stung the back of her throat. She tied a mask over her nose and mouth, pulled gloves on, and waited. The first ambulance backed up with its lights still flashing. The paramedics jumped out before it had fully stopped. "Male 45, one shouted. "Exposed to unknown chemical, burns to face and arms, short of breath, vomiting on scene." They rolled the stretcher toward her. The man's skin was an angry red, where it was not blistered white. His eyes were swollen slits. He coughed a wet, tearing sound that made his whole body curl. Emma stepped beside the stretcher, hand on the rail. "Can you hear me?" she asked. He nodded once, then coughed again, a string of saliva hanging from his lip. "Breathing compromised burns exposure," she said. "Red." She tore a red tag from the roll and fixed it to the rail. "Bay one," she told the nurses waiting behind her. "Get his clothes off, irrigate his skin, and eyes secure his airway before he closes off completely." They wheeled him away. The next ambulance brought a woman in her 50s with a gash on her forehead and soot on her clothes, but no breathing problems. She clutched her arm to her chest, grimacing. She was on the platform, the medic said, knocked down when the tankers went over. No direct contact with the spill. Emma checked her pulse. Her pupils ran a hand gently down the arm she held close. Pain, but no deformity. No wheeze when she inhaled. No burns on exposed skin. "Yellow," Emma said. "Put her in overflow 3. Someone close her head wound and get basic labs." Behind her, the room accepted each new body, swallowing them into bays and curtained spaces. More ambulances came. A man barely breathing, lips blue foam at the corners of his mouth. Red. A teenager with blistered hands from trying to pull someone off the tracks. Yellow. A firefighter whose mask had slipped, coughing so hard he could not speak. Red. A child who screamed every time someone tried to touch him. Eyes wide, hands uninjured, only a scrape on the knee. Green, but with a note to have someone sit with him. Her world narrowed to faces, breaths, the rise and fall of chests, the color of skin. Each patient a quick decision. Each decision a fork that might lead toward a bed or a body bag. Hands reached for her from every direction. Paramedics holding clipboards, nurses asking where to put the next one, a social worker wanting to know where families should wait. She answered without looking away from the next stretcher. "Reds to Cavallo," she said. "Yellows to hallway B, greens to the auditorium with security, families outside for now, only patients in here." Through it all, Hayes moved like a quiet axis. He spoke to Cavallo at the central desk, coordinated with anesthesia, checked on the capacity in the operating rooms. He did not interfere with Emma. He watched. At one point, Raj appeared at her elbow, breathing hard, a smear of something dark on his cheek. "They need you in Bay 3, he said. "Triple trauma. We are short a pair of hands that know what they are doing." "Find someone else," she said. "I am not leaving this door." He looked at her, surprised at the refusal. "You do not have to keep doing triage," he said. "You have done it for an hour straight. We can rotate." She shook her head. "They need you in Bay 3, she said. "They need me here, trust me." He hesitated only a second, then nodded and ran back inside. The ambulances kept coming. Some arrived 2 at a time. Once 3 backed up in a line, the drivers leaning on their horns. Emma's gloves became slick with a mixture of rain and sweat and whatever chemicals rode on the patient's clothes. She changed them whenever she could, but there was always another stretcher, another pair of eyes blinking up at her through pain or confusion, or nothing at all. She tagged one man white, the color reserved for those who would not make it to treatment in time. His chest did not rise. His pupils were fixed. A medic stood at the foot of the stretcher, hands frozen on the rails. "He was alive when we left the site," he said. "He was talking. He said his kids were waiting at home." Emma placed her hand on the man's sternum, more in acknowledgement than in examination. "I am sorry," she said. The medic swallowed hard and nodded. They moved the body to the side, covered it with a sheet. There was no chapel ready, no coroner yet. Just a corner by the wall where the dead could wait while the living fought for space. The sky outside the bay shifted from gray to a lighter shade. The rain thinned to a mist. Sirens still wailed in the distance, but less constantly than before. Emma rolled her shoulders to ease a cramp that had settled between her shoulder blades. The tag rolls on her belt were thinner now. Red nearly gone. Yellow fraying at the edges where her fingers had torn it again and again. Another ambulance pulled in, another stretcher. She stepped forward, hands already reaching. The next patient was a teenage girl with soot on her face and a rip in her jeans where her knee bled. She talked too fast, words tumbling over one another. "I was just there to film it for my channel. I did not even know what kind of cargo it was, and then it tipped, and there was this white cloud, and everyone started running, and I could not breathe, and my friend fell, and..." Her hands shook, but her lungs were clear. Her pupils were equal, Her skin was flushed, not pale. "Green," Emma said gently, "and you are scared and you hit your knee, but your breathing is good. You will be okay. Someone is going to clean that cut, and then I want you to sit in the auditorium where the air is clean." The girl nodded, swallowing hard. "Can I call my mom?" she whispered. "As soon as they are finished with your knee," Emma said. The stretcher rolled away. Another took its place, then another. She lost track of time. Somewhere between one siren and the next, the flow began to thin. The gaps between arrivals stretched from seconds to minutes. The radios on the paramedics' belts crackled with shorter reports. "This is the last one from our unit. Scene command says they are in mop-up." The final ambulance of that first wave came in with its lights still on but its siren quiet. The driver killed the engine. The sudden absence of the wail made the rest of the noise in the bay seem softer. "Male, late 20s, the paramedic said. "Minor exposure. He was further down the platform. No burns. Just scared and coughing." Emma checked his airway, listened to his chest. "Clear." "Green," she said. "Auditorium." The paramedics backed away, stretching cramped shoulders and rubbing their necks. "Scene is all yours now," one of them told her. "Fire is just putting out hot spots." She nodded. Behind her, the emergency department was full. Every bay held a patient. The hallways had people in chairs with IV poles beside them. The nurses moved from room to room in practice patterns. Dr. Cavallo appeared at Emma's side, a clipboard in one hand, a pen in the other. There were flecks of something dark on the cuff of her coat. "That is the last of the incoming from Harbor Junction," she said. "We are still getting a few walk-ins, but nothing like the first hour." "What are the numbers?" Emma asked. 41 patients so far with direct exposure or trauma, Cavallo said. 16 red, 19 yellow, 6 green, 1 dead on arrival. She jerked her chin toward the sheet-covered shape in the corner. Emma let the numbers settle somewhere behind her ribs. "How many on beds?" she asked. 7, Cavallo said. "ICU is scrambling beds." Hayes walked over from the nurse's station, a folded piece of paper in his hand. "Hospital capacity is holding," he said. "We have OR 2 and 4 running 3 on standby. ICU can take 4 more before we start using PACU as overflow. The rest we can manage here." He looked from Cavallo to Emma. "Nice work," he said. Cavallo snorted softly. "This one is a machine at the door," she said. "I have never seen triage like that outside a drill, and most of those are staged." She thrust the clipboard at Emma. "Take a look," she said. "See if you would change any of your tags now that we have more data." Emma flipped through the sheets. Each line was a patient she had seen for less than a minute. Name, age, tags, color, destination, current status. Red now in OR. Yellow downgraded to green. Green discharged from the auditorium after decontamination. 1 white tag at the bottom. Dead on arrival. She traced each path in her mind, where she had put her fingers, where she had heard breath or had not, where she had chosen not to spend a unit of blood or 10 minutes of a team. "I would not change them," she said. "Good," Cavallo said. "Because I would not either." She took the clipboard back and walked away, already answering another question from another nurse. Hayes stayed. 41 patients, he said quietly. No preventable deaths. Not 0 deaths, just none that belonged to poor decisions at the door. "It was not just me," Emma said. "I know exactly how much of it was you," he said. Her hands throbbed inside the gloves. Her shoulders ached with a dull, grinding fatigue. The adrenaline that had kept her moving began to ebb, leaving something hollow behind it. She pulled off her mask. The elastic snapped against her skin. "Can I step away for a minute?" she asked. "You can step away for an hour," Hayes said. "You have earned that at least." He touched her elbow, once a brief, almost awkward gesture, then moved back into the flow of the department. Emma turned toward the sink in the corner. She stripped off her gloves and dropped them into the bin. Water from the tap ran warm over her fingers, pink at first, then clear. The chemical sting in her nose faded, replaced by the familiar scent of hospital soap. She dried her hands and leaned for a moment against the counter, feeling the cool laminate under her palms. "Dr. Cole." She straightened. Agent Nina Alvarez stood at the doorway to the bay, hair slightly damp around her temples, black suit, now wearing a few drops of someone else's blood near the cuff. "Governor Reed is stable," Alvarez said. "He is awake. He is asking for you." Emma's first impulse was to say no. "I have patients," as she said. "And they have an entire hospital full of doctors," Alvarez said. "The governor asked for you by name. I suggest you come up while he is still able to string sentences together without more pain medication." Behind Alvarez, Hayes lifted his head from a chart. "Go," he said. "We will handle things down here." There was no space left to refuse. Emma nodded once. The elevator to the VIP floor was quieter than the one that served the main wards. The walls were paneled in fake wood. A soft instrumental track played from hidden speakers above their heads. Alvarez pressed the button for the top floor and leaned against the rail. "You did good work down there," she said. Emma stared at the numbers above the door. "It is what I am trained to do," she said. "Apparently, you are trained to do it better than most," Alvarez said. The elevator doors opened onto a carpeted hallway. The lighting was softer here, almost hotel-like. Security agents stood outside a set of double doors halfway down the corridor, their suits' unwrinkled earpieces in place. Alvarez showed her badge. The agent on the right glanced at a list and stepped aside. "Only the doctor," he said. Emma went in. Governor Thomas Reed sat propped up against a bank of pillows, his hospital gown gaping at one shoulder, an oxygen cannula under his nose. The color had not fully returned to his face, but there was more than the ashy gray she had seen in the operating room. A blood pressure cuff encircled his arm. The monitor beside the bed beeped in slow, regular tones. For a second, he looked older than his campaign photos, less polished, more human. When he saw her, his eyes filled with something that was not just gratitude, relief maybe, and something sharper. "Dr. Cole," he said. His voice was rough. "Governor," she said. He gestured to the chair near the bed. "Sit, please," he said. "I would stand to greet you, but my doctors tell me that is a bad idea this week." A ghost of humor touched his mouth. She sat. "You saved my life, Full," he said. "I think that is the third time my family owes you." She did not correct him on the count. "I was doing my job," she said. "I have heard you say that before," he said. He looked at her for a long moment. "My son speaks of you like you walked out of a myth," he said. "He talks about that tent, about the sand and the sirens, and the way you refused to leave him on that table, even when the base alarm was screaming at you to run." Emma kept her eyes on his hands. They were large, the veins raised under the loose skin. There was a faint tremor in his fingers when he reached to adjust the blanket. "I disobeyed orders," she said. "They were not wrong to court-martial me." "I was not there," he said. "I did not sit in that room, but I have read the transcripts. I have read the reports from everyone else who was in that tent. They are all still alive to write those reports because the people trying to kill them missed. My son is alive because you stayed." His hand moved toward the bedside table. A folder sat there, thick with papers. He picked it up and set it on his lap. "For 3 years," he said, "I have been trying to undo what that court did to you. It turns out that the military machine does not like to admit when it chews up the wrong gear." He opened the folder and pulled out the top document. "This is from the Judge Advocate General's office," he said. "It states that your court-martial findings have been set aside. Your discharge status has been amended from dishonorable to honorable. All associated rights and benefits restored." He handed the paper to her. The words did not immediately make sense. They were dense, full of phrases that had once been the language of her life and had since become foreign. She held the document without really reading it. "This is," he said, pulling out another sheet, "is from the Department of the Army. It confirms the change to your record and instructs that your file reflect your actual service, which in their words includes exemplary performance under hostile conditions." He placed that on top of the first. "And this wool," he said, "is from the State Medical Board. It acknowledges that your previous discharge triggered a review that led to your license being placed under a cloud. With the underlying issue resolved, they have voted to fully reinstate your license with no restrictions. They also note your trauma experience. Some of them sound almost apologetic." He smiled without much humor. Alvarez, standing to the side, now added, "The hospital credentialing committee has already received copies. Legally speaking, you are not a resident who lied her way into a program. You are a board-certified surgeon whose expertise was obscured by bad paperwork and worse politics." Emma let the papers rest in her lap. "You cannot erase what happened," she said. "No," Reed said. "We cannot. We also cannot pretend it was right." He shifted, winced, and settled back against the pillows. "I did not know your name until last night," he said. "I knew there was a Captain Cole out there somewhere. I had staff chasing threads, dragging their feet. Generals muttering about precedent. I stood on a lot of necks to get those signatures." He nodded toward the folder. "I should have stood on them sooner." Emma looked at him, really looked past the office and the title and the aura of power. "I lost my career," she said. "My team. My uniform. They took everything that told me who I was and told me I did not have the right to call myself a doctor. And yet you kept being one," he said. She did not answer. Alvarez stepped forward. "You can walk out of here," she said. "Find another hospital, change your name again if you want. No one can stop you now. Your record is clean. Or you can stay, with your real credentials, with your real history. That is your choice." Hayes appeared in the doorway. He must have come in on the last part of the conversation. "Grace Memorial would prefer you stayed," he said, "as an attending trauma surgeon, not as a first-year resident. We have already started the paperwork to correct your title. Assuming you agree, you would not be the first doctor here, with a past that does not fit neatly on a CV, but you would be the one who knows better than any of us what happened downstairs today." He did not come farther into the room. He left space between them. "Why?" Emma asked. Because I watched you hold an entire mass casualty at the door without flinching, he said. Because I saw the way the team moved when you spoke. Because when you opened that man in the trauma bay the other night, you were more afraid of losing the patient than of losing your place in my program. He let that sink in. And because, he added, this hospital owes its patients the best people we can get. Whether the army knew what to do with you is no longer my concern. Reed's eyes were bright. You taught my son that his life was worth breaking rules for, he said. You taught me that some costs are worth paying. I would like to see what you do when the system is not trying to punish you for it. Emma looked down at the papers again. Honorable, restored, reinstated. Words that tried to smooth over years of running. Her hands were steady now. She noticed that in an abstract way, the same way she noticed the soft hiss of the oxygen and the way the rain tapped faintly against the window. Can I think about it? She asked. Of course, Hayes said. Not too long, Alvarez said. Bureaucracies can change their minds. People at the top can retire. Reed smiled a brief, tired curve. Regardless of what you decide, he said, you will not disappear again, not on my watch. She stood. Rest, Governor, she said. He lifted a hand in a small salute. Thank you, Captain, he said. The word did not hurt as much as she had expected. In the hallway outside, the carpet muffled her steps. Security agents glanced at her, then looked away again, back to their quiet vigilance. Alvarez walked beside her for a few paces. You did not ask why the FBI cares, Alvarez said. I assumed it was because I am now tangential to a man whose face is on national news twice a week, Emma said. That is part of it, Alvarez said. It is also because people like you tend to end up in the middle of things that either go very right or very wrong. When they go right, I sleep better. Emma did not know what to say to that, so she said nothing. She rode the elevator back down alone. The emergency department was calmer when she returned. The worst of the wave had passed. The Reds were in surgery, or ICU. The yellows were lined up in hallways with IV poles and blankets. The greens were in the auditorium, restless and scrolling on their phones. No one stopped her as she walked through. A few nurses nodded in acknowledgement. One of the paramedics lifted a hand in a tired half wave. In the call room, she closed the door behind her and leaned for a moment against the wood. The room was as she had left it, blanket twisted on the bed, locker door slightly ajar, the metal box on the shelf paint dull in the dim light. She sat on the edge of the bed and reached up. The box was cold against her palms. She set it in her lap and flicked the latch. For 2 years, she had carried it without opening it, through airports and cheap apartments, and now into this hospital. It had been heavy in her duffel, heavy on her shelf, heavy in her mind. The lid creaked. Inside, on a layer of folded cloth, lay a small circular medal with a ribbon still threaded through it. The metal caught the thin light, dull bronze with brighter edges where it had rubbed against other things. Beside it lay a set of dog tags on a short chain, the stamped letters worn smooth in places by fingers and time. She lifted the medal. The inscription on the back had her name and a date, Kandar Ridge. When they had given it to her, it had come with a citation read in a flat voice. Words like bravery and sacrifice. Words that had felt hollow under the weight of the charges that followed. She turned it over once, twice, feeling the ridges under her fingers. Her hands did not shake. The sound of alarms from the emergency department drifted faintly through the walls, distant and muffled. She set the medal back in the box, not buried, but resting on top. The papers from the governor sat on the bed beside her, edges still crisp. For the first time, she let herself read them all the way through. 2 weeks later, the white coat still felt strange on her shoulders. Emma walked down the main corridor with her hands in the pockets, fingertips brushing the new ID clipped at her chest. The badge that had once read resident now held a different set of letters. Emma Cole, MD Trauma Surgery. The fabric of the coat was a little heavier than the short ones the interns wore. It moved differently when she turned a small weight that announced her before she spoke. She reached the door of conference room 4 and paused. Inside voices rose and fell, chairs scraped, someone dropped a pen. The smell of burnt coffee seeped under the crack at the bottom of the door. She took her hands out of her pockets and opened it. The room was full. Attending surgeons lined the back wall. Residents filled the chairs at the front, white coats and blue scrubs in uneven rows. Nurses, respiratory therapists, and paramedics stood along the sides, clipboards balanced on their arms. A projector cast blue light across the front wall. A title slide weighted her name in black letters beneath the hospital logo. Dr. Leonard Hayes stood at the podium. He looked up when she entered and gave a brief nod. Dr. Cole, he said. Perfect timing. Conversations thinned, heads turned. Emma walked to the front of the room past the first row where the interns sat. One of them, the woman who had called her a ghost weeks ago without knowing she was in earshot, stared at the white coat, then quickly looked away. Hayes cleared his throat. For those of you who somehow missed the last fortnight of rumors, he said, allow me to introduce properly Dr. Emma Cole. Some of you know her as a surgical resident who happened to be in the right place when things went wrong. That is an incomplete picture. The corner of his mouth tightened slightly as if at a private joke. Dr. Cole is in fact a board-certified trauma surgeon, he said. Before she joined us under somewhat unusual circumstances, she served as a combat surgeon with multiple deployments to a forward base that saw more casualties in a week than we see in a month. A low murmur passed through the crowd. During the Harbor Junction incident, Hayes continued, she led triage at our doors. We admitted 41 patients from that event. We did not lose a single one whose injuries were considered survivable. That is not an accident. Emma watched the faces in front of her. Some of the staff who had been in the emergency department that day straightened a little at the memory. Others who had only heard about it secondhand looked at her with a different kind of attention. Effective today, Hayes said. Dr. Cole is our Director of Trauma Services. She will be overseeing the development of a new trauma program at Grace Memorial that will affect every one of you who works with bleeding broken or burned people. He stepped back from the podium. Doctor, he said, they are yours. The phrase landed with more force than the words alone could carry. Emma took his place at the front. The projector light warmed the side of her face. She picked up the small remote, clicked once. The title slide vanished, replaced by a simple list. Thank you, she said. Her voice carried clearly, even without the microphone. I spent 6 years in a place where alarms meant someone was about to be dropped on a table in front of me with more injuries than any one person should have, she said. I learned how to move when there were more patients than hands. When I came here, I thought I had left that behind. Harbor Junction showed me that patterns repeat even when the landscape changes. She clicked again. A diagram appeared. Ambulance bay, triage zone trauma bays, or ICU. Lines traced the flow of patients. We did well that day, Bus, she said. We can do better next time, without relying on luck and improvisation. This program is meant to make that possible. She moved through the first points. Regular mass casualty drills, not just for emergency medicine, but for surgery, anesthesia, ICU, she said. Simulation of real scenarios, not sanitized ones, so that the first time you see 3 reds at once is not when they are breathing in front of you. Cross-training, she said. Surgeons who understand triage emergency, physicians who understand operative priorities, nurses who are comfortable stepping into roles outside their usual routine when the usual breaks. Standardized triage protocols that every person in this room can recite half asleep, she said. Colored tags mean nothing if we cannot agree on what they represent. A hand went up in the 3rd row. Dr. Anders, one of the older general surgeons, sat with his arms folded. He had a reputation for long cases and longer complaints. This all sounds very thorough, Dr. Cole, he said. It also sounds expensive. Simulations, time off the schedule for drills, cross-training. Where exactly is this money coming from, and what cases are we canceling to play disaster games? A few people shifted in their seats. Emma met his eyes. 2 answers, Bassim, she said. First, the funding. The state has created a grant for hospitals implementing advanced trauma readiness. Governor Reed's office has designated Grace Memorial as a pilot site. That means the program pays for itself for the first phase. A different murmur moved through the room at the mention of the governor. Second, she said regarding canceled cases, no one is playing. The time we spend in drills is not time lost, it is time moved. Anders snorted. Moved from the present to a possible future, he said. We have elective lists booked months out, people with hernias and gallbladders and knees that keep them up at night. Are you telling them to wait because we might have another train crash? No, Emma said. I'm telling them that if they happen to be in the wrong place on the wrong morning, they will land in a hospital where the team at the door has practiced for that day instead of hoping their hands remember what to do. Her tone stayed even. The words did not. Harbor Junction did not wait for a gap in our schedule, she said. Neither will the next fire or pile up or explosion from a lab that did not label its containers properly. Anders opened his mouth, then closed it. He looked down at his notes. Raj spoke up from the back. What is the timeline? He asked. 6 months to full implementation, Emma said. First month is assessment. We map our current response patterns. We identify bottlenecks and weak points. From there, phase by phase, you will all see schedules with drill dates by the end of the week. A nurse from the trauma bay raised a hand. Who is on the rapid response team? She asked. You mentioned that in the outline you sent out. Volunteers at first, Emma said. People from surgery, emergency, anesthesia, respiratory, blood bank. People who understand that when the pager hits a certain tone, they drop what they are doing and move. Eventually, I want coverage on every shift. The paramedic captain near the door nodded. We can adjust our own protocols to match yours, he said. If we know how you want them tagged and sorted, we can bring you a more organized mess. Exactly, Emma said. She clicked through to the last slide. There were no bullet points on it, just a photo. Someone had taken it from the 2nd floor during Harbor Junction. It showed the ambulance bay crowded with stretchers, paramedics, nurses. In the center, a small figure in blue scrubs stood with arms out, facing a gurney. Around her, people moved in arcs, following directions that the viewer could not hear. The room quieted. I know many of you did not ask to think about trains and chemical spills when you took organic chemistry, she said. You signed up to fix knees, remove tumors, repair hernias. You did not sign up for war. She let the words slide out quietly. I am not asking you to think about war, she said. I am asking you to think about the fact that every city has fault lines you cannot see. Ours run through highways, warehouses, rail lines, and old buildings. When they crack, we are the ones standing in the gap. She clicked the projector off. The image vanished, leaving the white wall blank. For those of you who worked that day, she said, you know what you felt. For those who did not talk to the people who did, then decide whether you want to be part of making sure the next time feels less like improvisation and more like something closer to control. Hayes stepped up beside her. Questions can be sent to Dr. Cole over the next week, he said. She will be holding smaller sessions with each department. For now, we also have patients waiting. Chairs scraped again. People stood. As they filed out, several paused to speak to Emma. A respiratory therapist touched her arm. If you need someone for that team I am in, she said. A nurse from ICU said, we have been asking for better protocols for years. It is good to see someone actually writing them. Not everyone looked pleased. A few surgeons passed with expressions that hovered between skepticism and annoyance. Change did that. When the room had mostly emptied, Raj lingered by the door. He waited until the last intern left, then walked back toward the podium. Nice speech, he said. A little terrifying. That was not the intent, she said. He sat in one of the front row chairs, elbows on his knees. I wanted to say something, he said, about the trauma bay, the one before Harbor Junction, the car crash. She knew which night he meant. The man's abdomen open under the harsh light, Raj's hands hovering paralyzed, her own fingers moving in his place. You already did, she said. I did not say it to you, he replied. He looked down at his hands. They were clean now. No blood, no tremor. He turned them over, palms up as if checking that they were really his. I froze, he said. I saw the numbers drop and my mind just stopped. I have been doing this for 15 years, and for the first time, I thought I'm not the person this man needs right now. Emma waited. When you stepped in, Raj said, I was relieved. That is the part I am not proud of. I should have been angry or defensive. Instead, I felt like someone had just taken a weight off my chest. He glanced up at her. You saved that patient, he said. You also saved me from making a decision by not making one. You did make one, she said. You stepped aside. He gave a short, rueful laugh. That is a generous interpretation, he said. He rubbed his thumb along the edge of his other palm. I do not want that to happen again, he said. Not like that. I will still have moments where I am scared. I know that. But I want to be the person who can keep moving despite it. He met her eyes. You said something earlier about training your staff before the bombs hit, he said. That they knew what to do because you had already drilled it into them. Can you do that for me, for us? Emma thought of the tent of Clark's face when she refused the order. She thought of the way the nurses had moved without waiting, of how their hands had found supplies before she asked. Yes, she said. That is the point of this program. He nodded. Then I am in, he said. For whatever you want to put us through. He stood, stretched his back, and picked up his folder. As he walked toward the door, he paused. By the way, he said without turning around, white coat suits you more than the ghost routine. When he left, the room fell quiet. Emma stood alone for a moment at the front, looking at the blank wall where the image of the ambulance bay had been. Her hands rested lightly on the edge of the podium. The pager at her hip was silent. For the first time since she had walked into this hospital with a single bag and a box she was afraid to open, she felt something ease inside her, a small shift in how the space around her fit. She picked up her notes, slipped the remote into her pocket, and stepped out into the hallway. The apartment was small, but it was hers. Emma stood in the doorway with a cardboard box in her arms and listened to the quiet. No overhead pages, no monitor alarms, just the faint hum of the refrigerator and a car passing on the street below. The living room held a secondhand couch, a narrow bookcase, and a cheap table that looked like it had come from a flat pack. The window faced west, giving her a slice of the bay between two taller buildings. In the late afternoon light, the water was the color of pewter. She set the box on the floor and knelt to open it. Inside were the things that did not belong in a hospital locker. A stack of books with cracked spines, a mug from her first year of medical school, a folded sweatshirt from a high school in San Antonio. On top, wrapped in a worn t-shirt, was the metal box. She lifted it out and placed it on the table. She had opened it once in the call room, long enough to take out the metal and the dog tags and put them back again. That had been an act of acknowledgement. This felt like something else. The lid creaked when she raised it. The metal lay where she had left it, ribbon coiled underneath. The dog tags rested beside it, chain tangled. The dull light from the window brushed the metal, catching in the stamped letters. She took the metal in her hand and carried it to the bookcase. On the top shelf between two medical texts, there was a small space she had left bare on purpose. She stood there for a moment, metal in her palm, feeling the cool weight press into her skin. Then she set it upright, leaning against the wall, the ribbon tucked neatly behind it. It did not glow. It did not change the room. It simply sat there, visible. Her phone buzzed on the table. She went back for it and glanced at the screen. Ben Cole, the contact read. The name looked wrong at first, like it belonged to someone else's list. She had put it in again the night she left the call room for the last time, fingers hovering over the keys. She had not pressed the call button. She did it now. The phone rang 3 times. "Yeah," a voice answered, wary. "Ben?" she said. Silence sharp and clean. "Emma," he said. Her throat tightened. "Hi," she said. "It is me." The sound that came out of him was a half laugh, half exhale. "Holy!" He cut himself off. "You cannot just call like a telemarketer, you know that, right? People think you are dead." "I know," she said. "So you are not," he said. "Dead, I mean." "Not yet," she said. There was a rustle on his end, like he had sat down hard. "Mom is going to lose her mind," he said. "She kept saying you would call. Dad stopped saying it about a year ago. I think he still believed it, he just stopped saying it." Emma leaned against the edge of the table. "I am sorry," she said. "Yeah," he said quietly. "Me too." The silence between them this time felt different. Less like a wall, more like a room that needed furniture. "Where are you?" he asked. "Seattle," she said. "I am working at a hospital here." "Of course you are," he said. "You were never going to do anything else." He hesitated. "Is it safe to talk about?" he asked. "Are there still people who do not know you exist?" "Some probably," she said. "But the ones who matter here know. The army fixed what it broke." She heard him let out a breath. "Good," he said. "Mom told everyone you joined some secret thing, Intelligence Witness Protection Space Program. She rotated through theories." "Space program," Emma said. "There was a documentary about astronauts. She got ideas," he said. Emma found herself smiling, the expression unfamiliar and a little sharp at the edges. "How is she?" she asked. "Cooking too much," he said. "Talking too much, asking too many questions." "So, Mom." "And Dad?" she asked. There was a small pause. "Working on the trucks," Ben said, pretending he does not limp, using words like fine a lot. She closed her eyes for a second. "I should have called sooner," she said. "Yeah," he said. Then softer. "You are calling now?" "I want to see you," she said, "if you want that." "Do I want my missing in action sister to show up at the house and prove to everyone that I am not crazy for still setting a plate for her on holidays?" he said. "Let me think." "Ben," she said. "Yes," he said. The word came out on a laugh that broke in the middle. "Yes, when I can come this weekend," she said. "If that works." "Mom will start cooking tonight," he said. "She will not stop until you get here. Bring someone. She always cooks for extra." Emma looked around the apartment. "There is no someone," she said. "That is a crime, he said. "We will work on that." The idea made her uneasy, and something else she did not examine too closely. "I have to go in early tomorrow," she said. "I will text you the time my train gets in." "Text me your address too," he said. "I am sending you photos of the new dog." "You got a dog?" she asked. "Of course I did," he said. "Someone had to take over chewing on my boots when you left." They stayed on the line a few minutes more, trading small updates. The details felt strange on her tongue. The name of his shop, the colors they had painted the kitchen, the fact that her old bedroom was now full of her mother's plants. When she hung up, the apartment was quiet again, but it felt less empty. Her phone buzzed almost immediately with incoming photos. A dog with mismatched ears, her parents on a porch she did not recognize, a blurry shot of Ben holding up a barbecue fork like a trophy. Another message arrived while she was scrolling. "Unknown number?" She opened it. "Dr. Cole. I hope this is still your phone. This is Luke Reed. My father said you are at Grace Memorial. If this is you, and if you have time that is not claimed by people in need of stitches, would you consider having coffee with someone whose life you once rearranged?" She stared at the words for a moment. Then she typed back, "Oh, I do have time. Coffee is usually claimed by hospital vending machines. Real coffee would be an improvement." There was a pause, then another message. "There is a place 3 blocks from the hospital on 5th. They make something that almost counts as real. Tomorrow at 6. She checked her schedule in her head. Trauma rounds early, a community meeting about the new drills in the afternoon, a stack of charts she could read later. 6 was open. 6 is fine, she wrote. I will find it. The next evening, she stood outside a narrow coffee shop with fogged windows and a chalkboard sign that promised ethically sourced beans and homemade pastries. The sky was bruised with the last light of day. People walked past in coats and hats, their breath visible. Emma pushed the door open. Warm air washed over her. The smell of espresso and sugar hit hard enough to make her stomach growl. Indie music played from speakers in the corners. A man at a corner table stood when he saw her. He had the same pale eyes she remembered from the tent, though they were clearer now. His hair was shorter. There was a scar along his jaw she did not recall. He wore jeans and a sweater instead of a uniform. One leg moved more carefully than the other when he crossed the room, a stiffness in his left side. "Dr. Cole," he said. "Luke," she said. They looked at each other for a moment, two people who had shared the worst day of one life and pieces of another. "I did not know if you would come," he said. "I almost did not," she said. "Because of my father?" he asked. "Because of what it brings with it," she said. He nodded as if that made too much sense. "I got us a table," he said. "And something that is supposed to be coffee. You can tell me if it meets your standards." They sat. The cups were warm in her hands. The first sip was strong and slightly bitter. "Real enough." "So," he said, "how have you been since the last time I saw you?" She raised an eyebrow. "The last time I saw you, you were unconscious with a chest tube and half your blood in other people," she said. "You were not much of a conversationalist." He smiled, the expression reaching his eyes. "I have improved," he said. "I can almost run a mile now without my leg complaining. I teach history to 11th graders. I do not recommend it if you are looking for quiet, but it pays the bills." "Your father said you were teaching," she said. "Did he say I sometimes throw chalk at the wall when they are not listening?" he asked. "He left that out," she said. "Selective memory," Luke said. He traced a finger around the rim of his cup. "I spent a long time feeling like my life was a debt," he said. "Like every day I woke up, I owed someone a good reason for it." "You do not owe me anything," she said. He looked at her. "You stayed when you could have left," he said. "You got torn apart for it. I am pretty sure that put me in the red column." "I made a choice," she said. "It was my job to make it." "Maybe," he said. "It was not your job to carry the punishment the way you did." She did not answer. "Do you still think about it?" he asked. "Kandar," she said. "All of it," he said. "Some days," she said. "Some nights." He nodded. "Me too," he said. "Sometimes it is the blast. Sometimes it is waking up in Germany with my leg in a cage and my dad at the foot of the bed trying not to cry. Sometimes it is your face for half a second before everything went black." That surprised her more than it should have. "You remember that one?" she asked. "I remember your eyes," he said. "You looked like someone who had decided something and was not going to undecide it." They sat in the hum of the shop for a moment, the clatter of cups and the hiss of steam filling the spaces between words. "I do not know what I am supposed to be with you," he said finally. "A patient, a friend, a walking reminder, all of the above." "You do not have to be anything," she said. "You are a person whose life intersected with mine in a way most people will not understand. That is already more than we will ever have with most people we meet." He let out a breath. "That sounds like a starting point," he said. They talked after that about smaller things, the traffic in Seattle, the way rain here seemed to move in sheets instead of drops, his students who thought history started with their birth years, her interns who still looked at her like she might walk through walls. When they parted on the sidewalk, the air had cooled further. Their breath showed in front of them in pale clouds. "Thank you for coming," he said. "Thank you for asking," she said. He shifted his weight, favoring his good leg. "If you ever want to talk about that day from your side," he said, "I would listen." "If you ever want to talk about it from yours," she said, "so will I." He nodded, then turned away, limping slightly down the block until the crowd swallowed him. Back in her apartment, the metal on the shelf caught the light from the street lamp outside. The dog tags lay still in their box. Emma sat on the couch, phone in hand, and sent a message to Ben. "Train arrives Saturday at 10, she wrote. "Tell Mom not to cook the entire state." "Too late," he replied. "You started a storm." She leaned her head back against the cushion and closed her eyes. The city outside moved on lights and windows, turning on and off, sirens in the distance rising and falling. Inside, for the first time in a long while, the quiet did not feel like absence. 3 months after Harbor Junction, the drills no longer felt like a strange idea. They were on the calendar now, orange notices in the staff room, texts that warned of simulated events, so no one would panic when the practice alarm sounded. Nurses rolled their eyes, then showed up early. Residents grumbled, then argued for more complicated scenarios. The rapid response team started finishing each other's sentences. It was late on a Friday when the hospital got a real test. Emma was in the trauma office, a small room with 2 desks, a whiteboard, and a window that looked out over the ambulance bay. The board held scribbled notes about protocols and upcoming meetings. A half-finished cup of coffee cooled beside her keyboard. She was writing an email about ventilator allocation when the trauma pager on her belt erupted. "Multi-vehicle collision, Highway 99, field report, 7 critical. At the same time, the overhead speaker crackled. Trauma code, multiple incoming, all available trauma staff report to the emergency department. The sound reached through her chest in the old way. The air in the room seemed to sharpen. She rose without pushing the chair back. It slid away behind her. By the time she reached the emergency department, the first siren was already audible outside a rising howl that bounced off the concrete of the bay. Dr. Cavallo met her at the junction between the main hallway and the trauma bays. "Pile up on the overpass," Cavallo said. One car rolled, one truck, jackknifed, one compact, went under the guardrail. They are bringing them all at once. Emma nodded. "You take bays 1 and 2, when she said. I will take 3 and 4. Raj can float. Where is my team?" As if on cue, the members of the rapid response group converged. The respiratory therapist from drills, 2 seasoned trauma nurses, a resident from anesthesia with quick hands and tired eyes. Raj tying on a gown as he walked. They had already done this in practice. On this, they knew where to stand. "Same pattern as the second drill," Emma said. "Move fast. Call out what you see. Do not wait for me to tell you to breathe." They took their positions. The first ambulance doors swung open. "Male 40s, bull," the paramedic shouted. "Driver of the truck, steering wheel injury to chest seat belt marks, short of breath, vitals unstable." "Bay 1, Emma said. "Get a line, get a chest x-ray prep for chest tube if needed." The second stretcher followed nearly on its wheels. "Female 30, driver of the compact. Decreased breath, sounds on the left rigid abdomen in and out of consciousness." "Bay 2, Cavallo said. "That one might need to go straight to the OR." Third and fourth came together. A teenage girl, glass in her hair, crying and asking for her phone. A man in his 50s with a broken arm and a long cut on his forehead that bled steadily but without urgency. 3 is red, 4 is yellow, Emma called. "All vitals on the monitor as soon as they are in the room." The fifth stretcher did not move as fast. The paramedics' faces were tighter. "Male 16, one of them said. "Rear seat, no seatbelt. Found unresponsive. Intubated in the field. No movement in his lower limbs. Pressure is low, SATs are labile." "Bay 3, Emma said. "I want him on my side." They wheeled him in the ventilator, hissing at his head, the tube taped in place at his mouth. His hair stuck up in dirty spikes. Blood had dried along one cheek. His legs lay too still under the sheet. "Name?" she asked. "Logan," the paramedic said. "Logan Ruiz. His mother is in the other ambulance. She was driving the compact." The teenager's skin felt cool under her gloves. She pressed fingertips into his groin. The pulse was there, thin and fast. "Get me blood," she said. "Type specific if we have it. O negative if we do not." They worked through the pattern. Chest x-ray, extended ultrasound across his abdomen, a quick check of pupils, reflexes, neck. The ultrasound probe glided over his skin. The monitor showed black where it should have been gray. "Free fluid," the resident said. "A lot of it." "Bleeding in the abdomen," Emma said. "Prep to open him here if we lose the pressure." His blood pressure sagged. The numbers on the monitor drifted downward. Her hand found the scalpel on the tray without looking. "Pressure is 60 sound," the nurse said. "Heart rate 140. Emma glanced at the board above the bed. Ventilation taking more effort. Oxygen saturations dropping. "We go to the OR, she said. "Now. He will not tolerate a stop here. Get anesthesia to ride with him. Call upstairs and tell them we are coming in hot." The team moved. They rolled the bed out of the bay monitors, clattering at the sides. The elevator opened before they arrived. Someone must have held it. In the operating room, time compressed. The incision, the surge of blood into the cavity, clamps on visible vessels, packs suction more packs. It felt like the car crash in the trauma bay, like Harbor Junction, like a dozen nameless nights in Kandar. Her hands did what they had learned to do. Her mind tracked the waves. For a while they held. "Pressure is 70, the anesthesiologist called. "Hang another unit." They gave more blood. They found another tear, clamped it, tied it. The monitor steadied in small jumps. For a while it looked like it might be enough. Then it was not. The bleeding came from somewhere they could not reach without taking apart everything that was still whole. The boy's body had taken more than it could bear before he ever reached them. "Pressure 40, the anesthesiologist said quietly. No response to fluids. The rhythm on the monitor stuttered, then slid toward a flat line. They worked until there was nothing left to work on. When Emma finally stepped back from the table, her gloves were the color of rust. The boy's face looked younger, without the tube, no older than the high schoolers who wandered around the coffee shop near the hospital in packs. "Time of death," someone said. The numbers went on the record. The nurse wrote them down. The operating room emptied slowly. The hum of the lights became louder when the voices faded. Emma scrubbed her hands in the sink. The water ran pink, then clear, then too hot. Her reflection in the metal panel above the basin looked like a ghost of the first days. tired eyes, damp hair at the temples, shoulders slightly hunched. Footsteps approached behind her. "You did everything you could," Leonard Hayes said. She kept her hands under the water for another second before shutting it off. "I know," she said. The words were factual, not defiant. "Still feels like not enough," she added. Hayes leaned against the counter beside her, staying out of the splash zone. "If it ever feels like enough, when a 16-year-old dies on your table, that is the day you should stop doing this," he said. She dried her hands. The paper towel scratched at her skin. "It does not get easier," she said. "It gets clearer," he said. "You learn to see the line between what was possible and what was not. It still hurts." She thought of the white tag she had attached at Harbor Junction, of the man in the corner of the emergency department under a sheet, of names that never made it to gravestones she could visit. "It does," she said. They walked out of the operating room together. Downstairs, the rest of the highway crash victims had settled into their beds. The truck driver was in the ICU with a chest tube and a growing list of jokes about airbags. The mother from the compact lay in recovery belly, sutured, unaware of the conversation waiting for her when she woke. The teenage girl with glass in her hair sat in a hallway chair, a blanket around her shoulders, texting furiously. Emma stopped once outside the ICU watching a nurse adjust a ventilator. "Go home," Hayes said quietly. "Sleep while you remember how." "Rounds at 6, she said. "They will survive if you are human for one night," he said. She thought of her apartment, the window with its strip of bay, the metal on the shelf, her phone with messages from Ben and photos of a dog with ridiculous ears. She nodded. Outside, the sky had started to lighten. The horizon over the water was split by a thin band of pale gold. The parking lot shone with the residue of an earlier rain. Puddles reflected the orange of streetlights and the red blink of the emergency sign. They walked together toward the edge of the raised walkway where the hospital's glass gave way to open air. For a moment, they stood side by side, watching the city wake. "Thank you," Hayes said. "For what?" she asked. "For not running, but," he said. "For staying after we saw you clearly. For letting this place be something other than just another stop between battlefields." She looked at the curve of the bay, at the cranes, silhouetted against the brightening sky, at the ambulances parked in a row like sleeping animals. "I tried running," she said. "How did it go?" he asked. She let out a breath that might have been a laugh. "I ended up here," she said. He accepted that answer with a small tilt of his head. "You know," he said, "for what it is worth, I am glad your file was as messy as it was. If it had been clean, you probably would have gone somewhere that did not need you as much." She did not argue. He checked his watch. "Go home, Dr. Cole," he said, "before some resident finds you and asks for a consult." He turned back toward the door's leaves of paper already appearing in his hands as if summoned. Emma stayed where she was for another few breaths. The morning air was cool against her face. It smelled of wet pavement salt from the bay, and faintly always of the hospital behind her. Her hands rested on the railing. They were empty. No scalpel, no tag rolls, no box. Cars moved slowly on the streets below. Somewhere a siren started up distant, but not calling her name this time. She reached for her phone and typed a short message to Ben. "Train is still on for tomorrow," she wrote. Reply came almost immediately. "Good. Mom already set out the good plates." She smiled a small private curve of her mouth. Then she slipped the phone back into her pocket, took one last look at the waking city, and walked toward the parking lot. The hospital doors hissed closed behind her. The sound followed her only a few steps before it faded, replaced by the quiet of early morning. She did not feel like she was leaving anything. She felt finally like she was walking out of one place that belonged to her and toward another. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts. So feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.